So our next presentation coming from Dr. Susan Upham, as well as a PhD candidate, Ryan Hines. And Ryan's also a certified industrial hygienist. Um, we're going to be taking a look at a case study, which is a multi-solvent exposure with high ambient heat in a confined space. And the Frank, I'm having the same multiple syllable word issues as you, right? The multidisciplinary consideration. I think it's a Saturday thing. But with that, I'll turn it over to you, Susan.
Okay. Well, good morning, everyone, and welcome to our Everyday Clinician Case presentation. In this lecture, we're going to review a real case of mine of a patient who had multi-solvent and heat exposure with neurological and possibly renal effects, and whose experience raised some serious safety concerns. We're going to explore multiple facets of this case. I want to spend some time reviewing the health effects of high heat and solvent exposures, particularly neurological and renal effects. We're going to review some best practices for determining kidney toxicity. And then I'm going to turn this presentation over to Ryan Hines, who's an industrial hygienist, who's going to give his perspectives from a safety standpoint on features of this case. So, this was a 50-year-old water department maintenance man who presented with the following story. It was early August 2024. It was a very hot and humid day. It was 92 degrees out, and he was working in a manhole repairing some damaged underground piping. And he was wearing a Tyvek suit without a respirator. He was applying a chemical mixture called Hercules PVC cement, which contains multiple solvents as listed on the screen. And he did this work for about 3 hours, but he became really sick. At one point, he said his arms and legs felt like rubber. He was drooling. He had nasal congestion, nausea, dizziness, significant sweating, and eventually vomited 6 to 9 times. He denied any cardiac or respiratory or irritant complaints and denied cognitive changes. His temperature was never measured. He got out of the manhole that day and he rested about 45 minutes on the side, and he decided to go home early that day. He thought he was just having an overheated situation. And I don't think the company was aware of what happened because they tend to be very aggressive and good about getting people in right away for medical care. But that evening, he did hydrate really well with Gatorade and other fluids, and he rested. He never took his temperature, and he ended up seeing me the next day. At that time, he said he was feeling a bit better, but he still had a bunch of symptoms. He was really, really fatigued. He had a sore and dry throat. The night before, he got a lot of phlegm in his throat, but that seemed to have resolved. And he had mild loose stool. And he denied any fever, chest pain, other cardiac or respiratory symptoms. He denied other irritation complaints. And so when I evaluated him, I did a good medical history on him. You'll see that listed here. I want to note that he only occasionally used alcohol. His medications are listed here. On exam, he had a mildly elevated blood pressure. His temperature was normal. And I did a really good head-to-toe evaluation on him, examination-wise, and everything was normal, except he had a little bit of mid-epigastric tenderness without any mass. So let's think a moment about what might have been occurring in this case. And certainly the first issue that came to my mind was, yes, was this possibly just a heat illness that he experienced? If we look at our guideline here for the various signs and symptoms of heat illnesses, you can see I was probably not really worried about heat rash or sunburn or heat cramps. He didn't describe any muscle pain or spasms. But as we look up into this table, heat exhaustion, he was having a lot of symptoms consistent with that. And I thought that that was probably possibly what the cause of his presentation was. If we look at heat stroke, I didn't think his condition really rose to the level of that condition. So at that point, as I'm formulating my diagnosis, as I'm going along seeing this patient, I certainly was thinking about, okay, what do I need to test? What do I need to be worried about? And one concern that came to my mind was, a possibility of a kidney injury due to high heat exposure. And I think there's good reason to consider this, since we know there's a relationship between excess heat and kidney disease. Studies out of Central America indicate that there's an increased risk of developing kidney disease termed Mesoamerican nephropathy. And the population that tends to be impacted tend to be young agricultural workers, with the most significant risk factors being very hard physical work in very hot climates. And what's probably happening is there's repeated episodes of acute kidney injury due to dehydration. And what happens in this case is that there's likely development of an acute on chronic interstitial nephritis, which is essentially an inflammatory condition of the kidney interstitium. There may be other factors associated with this, such as exposure to pesticides and agrochemicals, and other features as noted on the list here. But to expand on this issue a little bit more, heat impacts on the kidney can be quite variable, and I'll talk a bit about those here. For example, dehydration and hypovolemia due to excessive sweating and inadequate fluid intake can decrease renal perfusion, and so you get an accumulation of toxins in your blood, and that leads to something called azotemia. We also know that intense physical labor in high heat can result in rhabdomyolysis, and that can release myoglobulin into the blood and can cause acute tubular necrosis. We also know that sustained heat stress can increase renal oxygen demand, but that can decrease oxygen delivery, so you can develop a hypoxic injury to the renal tubules. We also know that dehydration can raise the osmolarity of blood and urine and can cause increase in certain toxins such as uric acid, and that substance can crystallize in the kidney and cause tubular obstruction. We also know that heat exposure can contribute to systemic inflammation and oxidative stress, which can, in and of itself, impact the kidney. And then we can see this recurrent acute injury problem leading to chronic kidney disease, as seen in this Mesoamerican nephropathy problem. However, we should point out that the impacts of heat on kidney is not confined to the equatorial regions of the world. For example, here we have a study published in The Lancet in 2024 that looked at ambient heat and acute kidney injury in over 1 million episodes occurring in England. And they were able to correlate these episodes with the daily maximum temperature data in the location where the episodes occurred. And they found that there was clearly an increased risk of acute kidney injury with high temperatures. The odds ratio for this was 1.63 on high temp days compared to low temp days. And then additionally, they had a 7-day heat wave in July 2021, where there was a little over a 20% increase in the acute kidney accounts which occurred. So, as you can see, I'm concerned about a kidney issue with my patient, but what about the effects of the solvents to which he was exposed? You can see here that several of the chemicals in this Hercules compound were associated with kidney effects potentially. And I started wondering, could there have been a synergistic or additive effect between heat illness plus this chemical exposure? So let's turn the page and do a quick review of the health effects of solvents. And I know that many of you have been well educated in this, but I thought a good review would be helpful, and maybe it'll jog your memory on some of these issues. And also maybe you'll be able to take away a few nuggets of new information to bring back to your practices. So first off, as you know, there's over 30,000 solvents in existence, and about 8% of our workforce have occupational solvent exposure. They tend to be either aqueous or organic based. However, the vast majority of industrial solvents used in industry are organic-based. The most common route of exposure, and this is due to the tendency of many of these to be very volatile, is through the pulmonary route, where it's thought that 40 to 80% are absorbed via the lungs. And this is going to increase with increased physical labor due to increased pulmonary ventilation and blood flow. We also know there can be percutaneous absorption, and this is going to be particularly seen in solvents that are more water soluble and often have low volatility, so they sort of hang around on the skin for longer periods of time. Health effects of solvents are numerous, and as you know, um, each one will have its own toxicity profile. Um, I wanted to talk about some of these here. Uh, Solvents can be associated with various cancers as listed here. There's also some research to suggest that parental occupational exposure to solvents can be associated with childhood leukemia. Well, what about alcohol? I thought, considering that the Surgeon General has recently said that alcohol intake is the third most common cause of cancer in our population, I thought it was worth looking at, well, what about occupational alcohol exposure? Interestingly, occupational exposure tends to be very low, so it's thought to be unlikely to increase one's risk of cancer to any significant degree, but there really is limited data on this to confirm this. I want to point out that our case was exposed, include exposure to chloroethylene, and that's been associated with several cancers as listed here. We also know there are adverse reproductive outcomes seen in individuals with solvent exposure, though unfortunately, there's limited or absent data on so many of these solvents. Possible reproductive effects can be reduced fertility, miscarriage, birth defects, low birth weight, preterm birth. I've given some examples here. Certain ethylene glycol ethers have been associated with miscarriages. Toluene, though it's not confirmed as a reproductive hazard, there have been several cases of recreational abusers of toluene, and the fetuses were noted to have microcephaly, other CNS problems, and minor head, face, and limb abnormalities. So back to alcohol. Again, generally abnormalities related to alcohol exposure would only occur if there was fairly severe exposure, which again is unlikely to happen. But if it did, it's thought to be associated with decreased fertility, abnormal sperm quality, menstrual abnormalities, and miscarriages. So other health effects, several cardiac effects have been associated with certain organic solvent exposures. Chlorofluorocarbons have been associated with cardiac sensitization to epinephrine, leading to arrhythmias and potentially sudden death. Based on animal studies, however, it's thought that the exposure needs to be fairly high for that to happen, but again, it can happen. High carbon disulfide exposure has been linked to increased cardiac mortality. And it's suggested that this contributes to atherosclerosis by damaging the endothelial lining of blood vessels, and that promotes plaque formation. Methylene chloride is kind of interesting because that causes also this myocardial sensitization, though it also gets metabolized to carbon monoxide. So ultimately could reduce oxygen supply to the heart, potentially causing angina, MIs, and cardiac arrhythmias. This, you can imagine this is going to be potentially problematic in individuals with pre-existing coronary artery disease, and it's thought that very high levels could lead to heart failure and sudden death. Moving right along, immunological effects have been seen. It's thought that there can be disruption of various immune cell functions, altered antibody production. People can have increased risk of infections. Also, offspring exposure in utero or exposure via lactation may affect the developing immune system and lead to long-term immune problems in the offspring. Potential mechanisms have been suggested, including direct cell toxicity, oxidative stress, and changes in gene expression patterns. Hematological effects can be seen. We know that there's some increase in certain cancers as listed here, and we've talked about that before. We know aplastic anemia can occur in a prolonged period of time after benzene exposure, and may lead to be a precursor to leukemia. We also know hemolytic anemia has been associated with glycol ethers. Now, liver effects, we think primarily of hepatitis as a big impact. Organic solvents of many types can lead to hepatocellular damage. And the mechanism of toxicity is fairly complex, but think of damage to the cells and then also the induction of inflammation in the liver as being a big problem with this exposure. Now, lastly, regarding pulmonary effects, now we know that a lot of solvents are well known to cause mucous membrane irritation. So, I automatically jump to the idea, well, it must really be a bad problem with lungs. However, the pulmonary effects don't appear to be quite as significant as you might think, and research on this is fairly limited and sort of inconsistent. There have been some reports of people developing chronic bronchitis with long-term exposure to the very irritating solvents. Rare case reports of reactive airways disease have been noted, and PFT changes have been seen with very high levels of formaldehyde exposure. Moving right along, irritation, as I mentioned, is well known to be a problem and can be caused by many, many solvents. Almost all solvents can cause some level of skin irritation, and it's thought that about 20% of occupational dermatitis is known to be due to solvent exposure. Um, Solvents can also cause allergic dermatitis, and I've listed several here, one of which my patient was exposed to. Scleroderma, sort of an unusual skin condition that manifests as sort of hardening and tightening of the skin, is particularly noted with some. And my patient was exposed to one, as listed in red here. Note that in my case, I think he likely had irritant effects with his delayed onset of a sore throat and phlegm production. Let's spend some time talking about some of the various neurological effects of solvents. Peripheral neuropathy can occur, and this tends to initially impact the feet and legs first and later the arms. And this is going to be manifested by sensation changes, loss of vibration perception, impaired proprioception, so that people get into trouble with balance problems, distal muscle wasting. And I've listed some notable triggers here. As mentioned by Frank, we know that there's impact on the hearing system. Other special senses can be impacted as well, such as loss of smell and taste. And there's a handful of solvents that have been associated with color vision loss, which many think can be very, very subtle and people don't even realize it's happening. We see this with, for example, styrene and carbon disulfide, N-hexane, just to name a few. And it often starts with blue-green loss and can progress to I'm sorry, it can start with blue-yellow loss and then move on to red-green loss. Um, Acute CNS effects can be seen, and most can cause some level of very non-specific central nervous system depression. And I think that's really relevant in the case that I have. We do know that solvents in some people who are regularly exposed, they can develop hangovers and withdrawals on the weekends. And this is due to a tolerance to the acute effects to the chemical involved. We also think there may be some additive and synergistic effects with people who are solvent exposed and who are heavily abusing alcohol. So that's going to be important to consider in your patients. Acute CNS effects tend to be a mix of manifestations of headache, dizziness, loss of consciousness. In severe cases, you can see seizures and death. And I want to point out that many solvents are volatile and can be explosive. So, explosion-related effects might be considered an acute effect as well. Long-term, we're learning more and more about long-term effects of central nervous system of the central nervous system due to these chemicals, including headache, fatigue, cognitive problems such as memory and concentration issues, irritability, depression, personality changes. We're also learning more that we can actually see neuroimaging evidence of central brain toxicity. Here's an example of this. The TANK study from 2011 looked at occupational solvent exposure and brain function using brain fMR studies. And this was a case control study where comparisons were made between exposed and non-exposed workers who completed something called an NBAC working memory test. And this is a validated test. And while they were doing this, they were undergoing an fMRI study of their brain. And their cases had worked with solvent mixtures on average of about 22 years. And the results showed that they were not only, the cases were not only performing significantly worse on the NBAC test, but there was also evidence of lower activity in the parts of the brain which served working memory function and attention. So moving right along, let's talk about the kidney effects of solvents. Various types of toxic abnormalities have been seen with certain solvent exposures, as noted here. But also there's evidence to suggest that people who already have some level of kidney disease could have a hastening towards renal decline, towards end-stage renal disease due to their exposures. And several studies have looked into this. For example, Jacob in 2007, this was a systematic review that looked at solvent-related end-stage renal disease based on occupations and the types of solvents that people were exposed to. And they found that the highest risk occupations for progression towards end-stage renal disease were these machinery fitters, machine assemblers, plumbers, welders, and the solvents with the highest risk towards this progression to end-stage renal disease were toluene, xylene, gasoline, fuel and gas oil, and ketones. Gee, we seem to see a lot about toluene these days. It makes you really wonder, should we even be using it? But in any case, they concluded, clearly there was a correlation between solvents and nephrotoxicity in some cases, but they really suggested there probably should be some screening for proteinuria in exposed workers so that you can have early detection and prevent progression towards end-stage renal disease. Here's another study which was published in 2023, and it was a systematic review which looked at the relationship between organic solvent exposure and chronic kidney disease. And what they found was a statistically increased risk of chronic kidney disease in various categories, even at low levels. And they also suggested that really we should be considering surveillance for kidney damage, especially in highly exposed workers. So let's go back to my patient. As you can see, we're going to be looking at the health effects of this substance that he was applying. And you can see that the acute effects are fairly similar across the board, with all of them potentially causing mucous membrane irritation, central nervous system effects such as headaches, dizziness, weakness, confusion, and so forth. But interestingly, all of them are or most of them were associated with GI effects. And as you know, my patient was really nauseous and had a lot of vomiting. And clearly they can cause respiratory tract irritation. I do want to point out, if you look at the last column under organ damage, um, uh, liver and or kidney impacts were mentioned as being potentially impacted by almost all of these chemicals. So based on his presentation, as you know, I'm evaluating him and thinking about what do I need to look at. I felt I needed to perform some lab testing, so I opted to just simply perform a chemistry panel on him. And so this was performed on Friday, August 3rd. And what came back was a mildly reduced EGFR, but my lab, Nordex, said This test has multiple limitations. So at that point, it was a little difficult for me to know, how significant this was. I ended up seeing him the following Monday. I had sent him home to rest and continue hydrate, and I saw him that Monday. And I repeated the chemistry panel, and sure enough, the labs remained abnormal. And at that point, he had told me he had had a routine physical exam by his personal physician about 6 weeks prior, and they had done a chemistry panel. And that was done with a different lab. And that lab showed an EGFR of 71.4, which was completely normal. So here I'm starting to get a little nervous about, maybe he really had a kidney impact here. And so I opted to have him back about a month later and repeated his tests. And sure enough, those tests remain abnormal. And at that point, I felt I needed a nephrology consult here. I was concerned about, we needed to really firm up if he had a kidney injury, what does that mean for workers' compensation and long-term, et cetera, et cetera. So we sent our request over to nephrology, our large nephrology group locally, and they reviewed the record, and they declined to see him, and they said he didn't fit their criteria for being evaluated. And at that point, I was pretty frustrated. So I called the nephrologist, and I had a really good conversation with him. And he indicated that Nordex, my lab, was not using the best calculator for determining EGFR. And he asked me, he said, there's a best type of calculator used by the National Kidney Foundation called the CKD epicreatinine equation. And he then asked me, did you do a cystatin C level? And I said, no, I didn't. I don't even know what that is. I've never seen that done. And he said that it's even better to use cystatin C as part of the calculator if you have it available. So based on the use of that calculator, he quickly put the numbers in, and he felt there was no evidence of toxicity to the kidney, and his EGFR calculation came out to a little over 80. He recommended a urinalysis, which I performed, which was negative. And if you notice, I put up that his calcium level was slightly elevated consistently. And he suggested, you really should send him back to his PCP for a workup of that. There could be something subtle going on there. So the calculator for EGFR can be found at the National Kidney Foundation website. And I went back there and I inputted all this data. As you know, I didn't have the serum cystatin C level because I've never even seen that done in our area. And I inputted his data. As you can see, you put in various features, the creatinine, age, gender, and a few other things. And his EGFR came out at 82. So I was pretty happy about that, actually. But to explore this further, I wanted to share with you that there's been a lot of investigation into this issue of EGFR calculators. And did you know that there are many, many different calculators used across the country in different labs? And most labs don't even do this cystatin C testing. And experts have identified this as a problem. So what happened in 2020, a task force was created by the National Kidney Foundation and the American Society for Nephrologists. And their goals were to really clarify the problem with what to do about all these equations and come up with the best standard equation. And they also had a concern about figuring out how to incorporate race as a factor and if it was even needed to be considered. And if you look at their report, you'll be shocked at how many EGFR calculators are out there. There are tons that are being used across the country. And ultimately, they recommended the use of this particular CKD epicreatinine calculator, preferably with cystatin C. They also recommended increased use of the cystatin C measurements, and they advised further research. And they suggested looking for possibly new and better biomarkers for kidney disease and other interventions to eliminate ethnic disparities and racial disparities in kidney disease. So final thoughts. Let's go back to this case. After all was said and done, My best guesstimate for his diagnosis was that he had a mixed picture of illness due to mixed solvent and heat exposure. And I thought there was really no way to really separate out those diagnoses really any further. I did review with him the results of the nephrologist, and he did follow up with his primary care physician. But the story doesn't really end there, does it? Because if you go back to what happened, there clearly were some real safety concerns that were raised in my mind about how he did this work with inadequate protection. And I did follow up with the company and discuss with this with them. And in follow-up, I did hear back that they got their safety people involved. They investigated further and they were going to make some changes with how they do this type of work. So that summarizes my case. And at this juncture, I would really like to turn the discussion over to our industrial hygienist, Ryan Hines, and he's going to walk us through his perspective on the safety considerations raised by this incident and also what we can learn from it.